What if I told you that we could help save our economy more than $100 billion a year? Medical non-adherence, commonly referred to as medical non-compliance, occurs when a patient deviates from the treatment plan created by his or her healthcare provider. My visual aid, courtesy of a 2014 Ben Comer report, shows that of avoidable healthcare costs, medication non-adherence accounted for more than $100 billion in the U.S. healthcare industry. Research suggests that medication non-adherence in the elderly is more prevalent because of an incomplete support structure from healthcare providers and patient financial burden. Today I'll discuss two of the reasons that affect elderly patients' ability to take medications as prescribed by their healthcare provider. An article in 2012 by Dorothy Jackson found non-adherence in older adults was more prevalent because, on average, a 65-year-old patient has 3 to 4 chronic conditions and takes at least one medication chronically. Some patients were found to be discontinuing medications due to side effects of the medications, which they incorrectly believed to be due to a worsening of their condition. Educational support and monitoring from healthcare providers, or simply more effective communication strategies, could mitigate this problem. According to a report by McDonald in 2012 entitled "The Adherence Journey: Activating the Patient," patients are not being actively engaged in their treatment plans. Traditionally, patients are prescribed a medication to help treat a symptom or problem that they've gone to a provider for evaluation for. Formulating treatment plans with elderly patients allows them to have shared clinical decision-making and has shown potential for a significant effect on appropriate medication usage. A third way that healthcare providers could better support the elderly patient and better ensure therapy adherence is by utilizing technological advances. Make it easy. Some ideas were new applications for smartphones or reminder phone calls from third-party vendors and pharmacies. Or, in a 2015 Casas et al. Article, showed significant increases in adherence rates with once-daily text messaging. Additionally, telemedicine or virtual telemonitoring can be an effective and cost-efficient alternative. My second main point gave financial burden as a reason for medication non-adherence. The addition of new medications can, for many elderly on a fixed income budget, present a sudden financial burden. A study by Drs. Latif and McNichol in 2009, entitled "Medication Non-Adherence in the Older Adult," found that many elderly patients with limited incomes began rationing medications or stopped taking them altogether to help decrease overall costs. Jackson, in a 2012 article, explained that many elderly patients spend more than 10% of their total income on medical costs, which includes medications, even being eligible for Medicare and Medicare Part D benefits. Jackson also found that when compared to people in Canada, which has a socialized medicine structure, older adults in the U.S. are more likely to report cost-related non-adherence. Those figures were 23% for the U.S. and only 8% for those in Canada. So today, I've discussed two of the reasons why elderly patients are likely to become non-adherent to a medication regimen. First, because of an incomplete support structure from the healthcare continuum. Second, due to monetary obstacles realized by the patients, many who are on a limited or fixed income. Are there many other reasons? Certainly. Intentional non-adherence, forgetfulness, and cognitive impairments are others. In fact, the title of the Dorothy Jackson 2012 article spoke to this. It was entitled "A Myriad of Multiples. Many Problematic Factors Contribute to Medication Non-Adherence in Elders." In conclusion, I want to leave you with a quote from the 2014 Ben Comer article that I found to put things in perspective. Everyone has a vested interest in prescription adherence. For pharmacy, payers, and providers, it's financial. For patients, it's personal. The return on adherence is paid for in the currency of health and life, which is harder to represent on a spreadsheet. Thank you.